Okay, Dr. Huebner with Natural Transplants. We're here with our patient for today, our VIP patient. This is Jane. She's coming up from North Carolina to see us here in our Washington DC clinic. And so we're very happy to have her here, and she was interested in kind of paying forward her experience to this point in her hair journey. So Jane, when did you start noticing your hair loss?
I've had my hair loss since I was about 12 years old. However, it progressively got worse, and I kept putting it off till I didn't have any options but to wear concealers and wigs and things like that. And I finally decided, hey, I'm too young for this. I need to do something about it. And I started my research. There are many different procedures and doctors out there that do hair transplants, but it's very important that you find the right doctor and do your research. I've had an FUE procedure in the past. That is not for my hair texture, which I had to find out the hard way. That's the reason why I'm actually doing this, so that people who are in a similar situation will be able to know, hey, if you have Caucasian hair type, Asian hair type, Hispanic hair type, African American hair type, all of those things will play a factor into the doctor that you need to choose and the procedure that you need to select.
Exactly, and that's great information for people that are in your same situation, and people are out there just trying to sell them a procedure to pay for a big fancy instrument that they bought. So not cool. So what are our goals for today for you, Jane?
Well, today I want to get my hairline back, get it a little fuller like it used to be, and hopefully get a little bit more, self-confidence back and
Sure.
Pay it forward. That's the most important thing here. I want to help someone else, because a lot of us are dealing with it.
And you are going to. So I'm going to show people what we've drawn here. So at this point in the day, we've already kind of discussed her hairline and what she's interested in doing. So we're not going to go super aggressive. We're not going to bring it down super low. We did put on a nice curved, natural, feminine hairline. You can see though that Jane's story is a little bit different in that she has patches of alopecia, not exactly a frontal band. And that is because she actually went and got a biopsy to kind of figure out what was going on with her, which is always a great first step, to see a dermatologist and get a biopsy. And she has a form of scarring alopecia that they found on the biopsy. Now, scarring alopecia in general is not great for transplant, but if it's been stable for a matter of years, then we're willing to do the transplant with the understanding that it's not a guarantee that that condition may flare up again and you can get some more scarring. So we've talked about all that stuff. Jane is fully aware of that, and we talked about her limitations. The other interesting thing about her case is that because she did have the FUE, she does have a little bit of scarring in the back already. So we're going into this with kind of full understanding, a little bit of a mess, but we're going to do the best we can for her. We're going to jam-pack it in as much as we can, fill in that frontal hairline, get her edges back for her, and hopefully down the road she'll have a good result. And then the last question for you is, how'd you find out about natural transplants?
I found out about you guys the same way I'm letting other people know about you guys. I saw several videos on YouTube with people who looked like me, who had similar textured hair, and that's what intrigued me, and that's what brought me to you guys.
Excellent, excellent. You want to have someone experienced with your hair type, yes, certainly. So we're gonna have a great day today. We're gonna get you back in the room here in a second, and we'll check in on you in a few minutes.
Okay.
Okay, so this is Dr. Huebner back with Jane, and we at this point in the procedure in the day have removed her donor strip. And we've cut up and made all the little grafts over there at the stations. And Jane, how's your day been so far?
Good.
What have you been doing?
I've been watching One Tree Hill on Netflix all day.
Good. Have you been comfortable?
Yeah.
Great.
I can't feel anything.
Can't feel anything, not even emotions. No, but we've been having a good time. We've been discussing everything throughout the day and kind of reviewing her case. She's an interesting case for sure, given her history, and her history is actually why she really agreed to make this video, because she really wants people to understand the things that are going on out there and things that are being offered as treatments that may not be the best thing. So if you want to give your kind of 2 cents again about that and kind of pay it forward, we'd be happy to hear what you have to say about that.
Yeah, I mean, I'm grateful for what is being done today for me, and had I known about this sooner, we would have been able to do a lot more for what my situation is. But that's why it's important for you all to Do your research early. There's a lot more information out there now than there was when I started on this journey. So let's just make sure that you guys go and get that information and seek it out. Do your research.
Exactly. Make sure that you are dealing with a hair restoration surgeon that has done your specific type of hair, whether you're African American or Caucasian or Asian, whatever it may be. It's very important.
And every case is different. I would recommend getting a scalp biopsy just so you can know what you're dealing with and how to move forward with it, because that's important.
It's very, very important. One of the things we stress in our consultations, actually, because different kinds of alopecia can mimic each other. So you may think, oh, I had my braids or my hair in braids for a couple years, this has to be traction. You go get a biopsy, it turns out it's something different, and it makes you rethink your whole strategy. So the other thing that's happened is at this point in the day, we've created the sites where her grafts will go. I'm not going to go too close because there's a little bit of oozing, but our preference, given the limited number of grafts we had to work with her, was to really hit that frontal area hard, and then on the sides, do as much as we could. And we understand that going in, that this is not the optimal case, but we're going to do our best for Jane, and we're expecting to have great results where we did our procedure, and we'll follow up with her in a few more minutes when she's done getting the grafts in. Thanks a lot, Jane. Okay, Dr. Huebner back with Jane, and at this point in the day, Jane has completed her entire procedure, just under 6 hours. We've been at it, and definitely a little bit more of a suboptimal case because of her history that we've talked about with her previous FUE procedures, and very happy with the amount of hair we were able to get Jane today and the amount of coverage. And we have to have realistic expectations going forward, but Jane totally understands that, and she's been a great patient. So we'll take a quick peek here at what we were able to do for her, and you can see all those little bumps are where her new hairs are going to be, and we're able to fill in a little bit more spacing on the sides just to try to cover the area. Like I said, if we had a little more tissue to work with, we would have been able to fill it in a little bit more, but this is going to make a huge difference for her. And we were joking around and we said, congratulations, this is your first hair transplant. So not funny, but unfortunate. So Jane, how's your day been with us? And just tell us a little bit about the experience.
Well, my day has been great. I'm relaxed. I feel good. I feel good about what was done today. I kind of, feel like I wish I had known about these things earlier. Mm-hmm. Please, if you have a coarser or curlier texture hair, FUE, even though it's not as invasive, it's not what we need to do. And I had to find that out firsthand, and it kind of limited what they were able to do today for me, but I still feel like I'm gonna have a good result and have my hairline back. So
and the conversations we've had throughout the day, very nice. I think we've kind of both understand where each other are coming from, and she has confidence in us, and I have full confidence that she'll be able to take care of this going forward. And that's actually the next thing we're gonna do, is talk about how she's gonna take care of this over the next few weeks. And then after that, easy peasy, just looking forward to the new hair growth in a few months.
Yes.
So we'll be following up with Jane and her progress, and we're very happy that she decided to really pay forward her experience to other people, and hopefully people will gain a lot from your story. Thanks so much.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.